Hey everybody, this is Dr. Dukes with Body in Motion. We're going to go over shoulders this month. There's really three areas that we would see people that come in with shoulder pain. That would be the areas that we would hone in on to treat. All of them have some similarities and some blending. Shoulders are all affected by posture. So every one of these points of pain could be affected by poor posture. Now we will kind of tease out if something needs to be mobilized a little bit more, something needs to be stabilized and strengthened a little bit more, and then how we might treat certain things based off where the point of pain is or the asymmetry in movement. So the three areas are the front of the shoulder, the anterior shoulder, and then we've got the back of the shoulder, and then in between the shoulder blades, like more close to the spine. Those are the three areas that we would typically look at and see pain and have patients come in complaining of that. So now when we're looking at the anterior shoulder area, we're looking at tissues that are the bicep tendon and other muscles in the upper arm. We've also got the pecs. We've got the subclavius and the clavicle, and then some of the muscles on the anterior neck, the SCM and the scalene muscles, right? So we could have tendinosis, we could have an injury, we could have a throwing issue, but most of the time we're going to see impingement be a big problem and bicep tendinosis. Those are the big ones, possibly a labral tear. Then if we go to the back of the shoulder, we're looking at teres minor, the rotator cuff muscles, just basically weak back muscles that won't allow, that just are overworked really a lot of the time. And then when we think about the scapula not moving, we're really kind of thinking about more that, so we have two joints in each shoulder. So we have the glenohumeral joint, and then we also have the scapula and how that moves on our ribs. So the scapula is supposed to be very mobile, and then the glenohumeral joint is supposed to be really stable and protective. Now, sometimes we can get injured and we flip those, and that's where we start to get overuse and traumatic injuries. I mean, you could always fall and have something tear, but really a lot of the shoulder pains that we see with patients, it's over time. It's that thing that we do millions of times that leads us to have a problem. And usually our body finds a way to work around that for a while. So then we have to kind of uncover all the issues and rebuild proper movement, whether that's mobilizing, stabilizing, a little bit of both, and then soft tissue and some sort of manipulation is kind of the recipe that we would work on most shoulders with. So if this is something that you are struggling with yourself, I recommend you would schedule a discovery call or book an appointment online, and we're happy to help you out. And then we're going to be sending out some more interesting content over the next month on shoulder health in general.